Hello, everyone, and welcome to our tips and tricks for accessing First Call, the mental health system of care and resources workshop today. All of our workshops, including previous ones, are recorded and can be watched on our VFN YouTube channel. The link is on our website, which is vermontfamilynetwork.org. Everyone who is registered for today's workshop will receive a follow-up email with a link to this recording, and a PDF copy will be sent out. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. Today's workshop is being recorded, so please keep that in mind as you share information about your situation. This session will include live captions. If you want to turn off the live captions, click on live transcript, then hide subtitles. If you are comfortable, you are welcome to turn on your camera. You can ask questions using the chat box, which you'll see at the bottom of your screen. We will save time at the end of the presentation to answer questions. Feel free to share information or links to resources that you've found helpful in the chat as well. We know that we can learn a lot from each other. I'm excited to introduce you to Mariellen Woods, Clinical Director of First Call for Chittenden County at Howard Center, and Jessica Coleman, Intensive Service Coordinator and Act 264 Partnership Coordinator at the Howard Center and NFI Vermont. Thank you so much both for being here and joining us today.
Good morning, everyone.
Good morning. I'm going to start sharing the screen, Marielle, but feel free to go right ahead.
Okay. We're looking forward to talking a little bit about First Call and the system of care and resources. Our hope today is to do a really broad overview of things, because we really want to make this training about allowing for opportunity for all of you to ask questions and really focus in on what's most important for you and such. And so our goal for this training really is to just provide some basic information so that you know how to access resource and that you're comfortable accessing resources and such. So if you want to start with the first slide, Jessica. So we'll definitely we're hoping to allow for at least 15 minutes at the end for questions, so that this training really allows for us to have more of a conversation versus just me talking at you as fast as I can for an hour, because I could do that and in fact could provide you with a lot of information, but we really would rather just have a conversation today. So just to give a little bit of a overview of First Call. First Call is located at, and I didn't write this in, but 1138 Pine Street in Burlington. We are part of Howard Center. Howard Center is our designated mental health agency, and so we are the crisis team for the county. We operate 24/7, so there's not a moment of the day or the year that you won't be able to talk with someone. We really believe that the caller defines the crisis and that there's really no criteria to call. Anyone can call, and that includes, you know, any child, adolescent, parent, caregiver. We have people that call from our emergency room, from schools, concerned citizens. It doesn't matter, anyone can give us a call. And we provide phone support, telehealth assessment, and in-person services and assessment. We are fully mobile throughout Chittenden County. So we do have people at our emergency room at UVMMC, and we have clinicians there around the clock. And then we also have community-based clinicians that can go to people's homes. Like I said, schools, primary care office, anywhere. I've been very creative as to where I've done assessments in my lifetime. I can tell you some interesting stories about that actually. But it's because I really believe that it needs to be in a place where it's comfortable for everyone. And there have been some restrictions with COVID, but we still are serving people face to face, or like I said, telehealth, if that's helpful. And we do serve people across the lifespan. We have served 4-year-olds, but as you might guess, that might be through a little bit more of an observation and kind of a play interaction. And then we talk more with parent or caregivers in that situation. And we've also have conversations and see people that might be 80, so it's really a pretty diverse group of people. We provide supportive counseling, crisis assessments, resources, referrals, safety planning. We respond to community tragedies. We do trainings. It's really what people need. So I always think that it's a little stressful. Jessica, I don't know. You're covering my words here. So I'm going to just see if I can. Sorry about this. But anyway, there's a little box here covering some of the words. But anyway, so I think it's really kind of stressful to call and speak with a stranger. And so I kind of thought it would be nice just to know, like, when you call, what actually would happen. So our first call clinicians are all trained clinicians, and certainly we would ask, what we could do to be helpful today. And I think that one of the, tips and tricks of calling first call is, because our service can be pretty diverse in what we do, it's really helpful to say, if possible, what you're looking for when you call. And so, for example, would you like to just obtain supportive counseling, kind of a listening ear? Is there problem solving, say, like around a resource or say a parenting issue? And there are people that just need to call and talk, and there are people that need to, they have specific questions or needs. And so it's just, the more that you can articulate what you need, the easier it is to respond in a way that would be helpful to you. The other thing is that when we provide supportive counseling and resources and such, we're also, because we're a crisis service, we're also asking, if this is an emergency, do you need help calling the police or 911, because we can't immediately serve you. And also, there are times when you call that you will get the answering service, because we're on the other line. We have an answering service, and we do our very, very best to get back to you within 15 minutes or less. The other thing about calls is that we're always aware of safety, and safety is paramount. And so when you do call, we are really going to focus on, are there safety concerns? Is there risk of hurting anyone wanting to hurt themselves or others? Any risk of concerns about suicide? That's just part of our service. And so we might just gather some basic information. Sometimes when you just want to talk, you don't want to give me basic information. But what I would say is that we gather the information because if there is an emergency, it's really important for us to know if, who are you, what's going on, is there immediate safety concerns, just basic name, address, phone number, so that we can help you to get immediate help if needed. And then once the basic safety information is addressed, we would then just talk a little bit more about, like a little bit about, like, do you have services? Do you have supports? Who are they? And there are times where, like, a teenager will call and we want to say, is your parent or guardian aware of the call? If an adult is calling us, we also want to say, is there anyone else living in your home? Do you have any other supports, and that type of thing? And then also, has this situation happened in the past? Has there been anything that's been helpful? When you have a therapist, when you talk with that therapist, or there are certain skills that they're working on with you that we can just help you with. So those are some of the commonly asked questions, but we want to be able to strike that balance between asking questions to ensure your safety, but also allowing an opportunity for you to talk as well. And then if we can't solve the situation over the phone, meaning that we don't provide you with the support and help you need, then we move toward having an assessment. So when we assess, the common question is what actually happens? Because again, recognizing that sometimes people don't have a relationship with the clinician because they're brand new to our service. Other times people have been assessed multiple times over the years. So it really varies. But a first call clinician will provide an assessment in an agreed upon location. It should be noted that we do have many assessments that occur every single day. And so unfortunately, I wish I could say that you call for an assessment and we'd immediately go out, but we do, sometimes it takes a while, and it may take an hour to get to you. It may take the whole day, just based on our availability and such. But if there's a more immediate need because of safety, we do have people also go to our emergency room because that's a place where people can be safe, where they have medical and psychiatric support, as well as our clinicians up there. So that is an option if needed. We do have paperwork that we complete, and we provide an overview of our services so that you know what to expect. We don't just dive into, what's going on. We want to just make sure that you know who we are, limits of confidentiality, what the assessment's going to look like. So we'll always go over all of that with you. And then we're going to really ask you to talk to us a little bit about the current situation, gather a history, discuss contributing factors. We always assess for risk. We're often gathering collateral information as needed. So if a guidance counselor calls regarding their student, of course, we're getting permission from the parent to have the assessment, but we're going to ask the guidance counselor, tell me what's going on and why you're referring this student to us today. The same thing too, like, if someone has a therapist or something, they could probably provide us with some good information that would be helpful to better serve you. In addition to that, we have an electronic health record. So if someone is seen more than once, then we are reviewing that record. And part of that is because we don't want to have you repeat your whole entire story again when we're assessing you. And then our main goal is to make a determination. Does someone need an outpatient plan, which just looks at services and resources in the community? Or does someone need to be referred to our hospital diversion programs or our hospital program? A hospital diversion program, we have 3 in the county. Jess might be talking about that in a little bit, so I won't review that right now. And then the hospital, again, it depends if you're a child or an adult, what hospital. For kids, it's primarily Brattleboro Retreat or Champlain Valley Physicians Hospital. For adults, we have more hospitals across the state that we access. And part of our assessment includes restricting means. And so we look at following up with providers, safety planning, and we always make sure, like we always ask, are there guns in the home, medications, part of our Zero Suicide initiative, where we really look at the 2 main means that the people die by suicide is through guns and medication. So we provide gun locks, we provide lock boxes to lock up medication, we provide phone follow-up if needed. And if someone is waiting for a placement, then if they're in the emergency room, we're seeing them ideally every single day. to check in. And then if someone's waiting in the community for placement, we're seeing them in the community. Jess, next week. Good. So this is you?
This is me. So I'm going to jump in a little bit and talk a little bit about kind of what happens next, like what happens if you've had a first call assessment, how might you kind of move into our system of care and access services, or even if you're not accessing first call, kind of how else do you get into kind of our system of care? So one way maybe through first call, as Mariellen talked about, they can provide referral information, they can make referrals, they could just provide you phone numbers or some direction. Some other ways, kind of the usual front door ways that we think about coming into Howard Center for Services is through our access and intake program. That is, you see the number there, it's our 6,000 number, and we have people answering those phones and helping kind of think about either offering resources or offering an intake appointment and an assessment to come in for services. Partners for Access is also it's housed through Howard Center. It's a single point of entry for specifically looking at outpatient counseling for youth and families. And so that number can be called and you can get information and resources and connected to providers throughout our county for children and families. So that's the way to think about kind of coming into Howard Center for services. So sometimes it comes through first call and sometimes it comes through our access and intake line. I also think there are many more ways that people access services. So I just listed some of these. So we talk to a primary care physician. We have very strong working relationships with primary care offices in our county, and many have in-house social workers or care coordinators that have a strong working relationship. And often they are people that have worked at Howard Center, which is really helpful. And so that's a great way to think about, resources, asking questions of like, how do I get connected to services? So talk to a primary care or pediatrician. Also talking with school staff, if a child is in school, guidance counselors, nurses, in-house social workers, special ed, administration. Those are just some of my ones that I came up with as ideas. Again, I really can emphasize that I think we have many professionals in our county and area that know resources and can provide direction on kind of who to call, how to call. They can provide you, again, the access and intake line or the first call line, or they might know someone in a program, frankly, and you want to get some more information. So that's often how we think about people kind of coming into our system and looking for resources. One of the things I wanted to spend a little time on was talking about our system of care. So I am specifically talking about the children's mental health system of care. I'll touch on some of the other systems, but I'm going to start by kind of just talking about children's mental health services. So within our system of care, we have private and public systems of care. And the public system of care is made up, and Mariellen mentioned this, of designated agencies. So Howard Center is the designated agency for Chittenden County. Throughout our state, there are 10 designated agencies throughout our state. Many are regional. Howard Center is specific to Chittenden County because we're so large. And then it's also made up of specialized service agencies. So that it kind of, and it explains itself a little bit. They are just that. They are specialty agencies. In Chittenden County, we have NFI Vermont, which is Northeastern Family Institute, and that is our specialized service agency for intensive children's mental health needs. There are, I think this is accurate, I just learned this recently, I think there are 6 specialized services agencies throughout our state. NFI is the only one that provides intensive children's mental health services. A lot of the other specialized service agencies in our state are either adult mental health services or developmental services, but just for some context of what our system is. Within our public system, like there obviously are a lot of other agencies that people have heard of. So like we have Centerpoint as an agency in our area, and Spectrum is in our area. So there's a lot of Lund. I mean, there's a wide variety of other agencies that were within our public system. And then when I think about the private system, I think about really often those kind of private therapy practices or outpatient practices, or someone that is a private therapist that might have an office in their house, or that kind of thing. And so they are often that private network of individual therapists or private agencies. There are also is a whole network of private residential programs. So just thinking about there's a difference. I bring that up also because I always have to talk about funding. It's not a really fun thing to talk about, but it's something that really is important to know when we think about our system of care. So our public system of care, mental health system of care, really primarily operates using Medicaid. And that's important for people and families to know, because most of our services rely on billing Medicaid and having that youth have Medicaid as a insurance. It doesn't have to be their primary insurance, but as at least one of their insurances to access many of our systems, not our services, excuse me. Not all require, but it's something important to know. I know that Vermont Family Network has a variety of resources on how to access Medicaid, because there's a variety of ways to do that in our system. We certainly are increasing options within our public system for families and youth that have commercial insurance. A lot of our outpatient providers can take different commercial insurances based on their license. And we are increasingly creating programs that are using commercial insurances to bill some of the other services that have only been available through Medicaid. So I'll just give an example. Blue Cross Blue Shield has we're still calling it a pilot program, although it's been around for a while now. But Blue Cross Blue Shield pilot program is a program that is allowing families to get in-home family services, which I'll talk a little bit more about that. But allowing us to bill private insurance for that kind of in-home service coordination support work, which previously has only been billed through Medicaid. So that's one of the ways that I think our system is expanding to meet the variety of needs and variety of ways, frankly, that people get insurance. So that's just a little bit about the system. I always want to emphasize that there are multiple systems. I am a visual person, and so my analogy is always thinking about one of those solar system models and thinking about like all the different systems we have are different planets in the model, and they all interact with each other, but they're separate systems. So as Mariellen talked about the crisis system, so First Call and some of those crisis placements are really its own system, certainly interacts with other systems, but it has its own kind of rules, regulations, criteria for placements, that kind of thing. The education system is another kind of separate system in Planet that operates in its own way. Also, DCF or child welfare is one, developmental services, and then thinking about adult services. So I always want to really help people understand a little bit visually that while those systems all connect, they all are separate in the way that they kind of operate in terms of regulations, funding, that kind of thing. I'm going to get a little bit more into kind of the levels of care within children's mental health services. I think this comes up quite a bit. I often, again, as I've said, I'm a visual person, so you'll see me that's how I think about it. So you'll see my little arrow shows that the intensity, actually my arrow is going down, but that's just because it's on a flat piece of paper. But again, if I had like a model, you could see what I'm talking about. So really what I think about our system of care is kind of entry level. How you come into our mental health system of care is often by getting an outpatient provider. So maybe you've gotten a referral through primary care or through First Call or through even Partners for Access. And that's usually the first point of entry and service for youth or families coming into our system. And that can be provided by a variety of agencies, both within the private and public world. And that also then depends on a variety of insurance that can be used, again, depending on license. The middle section, thinking about community-based or that in-home family services, is really the bulk of what the children's mental health system of care provides. It just looks different at different agencies, as well as at kind of different levels of programs. But kind of the general model for children's services, when people think about in-home family services, is, and I'm going to say in-home because I know we're in a pandemic, But the idea is that we are in people's homes, connecting with families and children in their kind of natural environment and across settings. And so generally the model is that a clinician in any one of our programs is assigned to a family and really doing focused mental health work with a child in the context of that family setting. It looks different in terms of intensity and specific programs. So we have programs that do once a month or once a week contact with families, and then up to some of our more intensive services like what NFI provides. We are talking about intensive wraparound services where a youth is getting therapeutic contacts as part of that in-home work multiple times a week for, frankly, sometimes many hours a week. So it looks different. So we have this model of service available at Howard Center. We have these services through NFI. Spectrum has some in-home services through their Compass program. And then Beckett Family of Services has a community-based wraparound program as well. The highest level of service that we have within our children's mental health system is thinking about out-of-home placements. And some are community-based. And this can look like some of our therapeutic or treatment foster homes or foster placements that we have. We have those available through Howard Center and NFI. And these are separate from DCF. So again, if we think about the different planets, like this is one of the times that DCF is, they have their own little system of community-based beds, as well as mental health has some different community-based treatment foster beds. So that is an out-of-home placement that is considered an intensive community-based treatment. And then beyond that, the highest level is looking at a residential level of placement. And those are all requests that go through the Department of Mental Health. And thinking about, again, access, I am someone that my role and what I do in my intensive services role is I help families, teams, providers, anyone can call me, talk about the system of care and navigate the system of care. I also help teams access that highest level of care in residential. And I'm really the liaison with the Department of Mental Health because they're the ones making those specific determinations. When we're talking about a residential level of care, sometimes we talk about assessment beds, so kind of a short-term stay for assessment in a residential setting, or we're talking about long-term care. And our Department of Mental Health, Children's Mental Health, accesses programs both here in Chittenden County, throughout our state, throughout New England, and frankly, throughout the country. There is an increasing network of programs that are looked at. I will say that the philosophy is absolutely to always keep kids in their home community or as close to their home community as possible, because we know that's where the most success is. I'm going to do just a little quick plug in here for Act 264. There's a lot of resources for Act 264, both obviously through Vermont Family Network, IFS website, as well as myself as the Chittenden County Act 264 Partnership Coordinator. But it's a thread that kind of comes through all of our systems and kind of helps people access the system at times. So I just wanted to do a quick facts slide on it. So Act 264 is an interagency process. It's meant to be collaborative with the family as the kind of expert and center of discussion in terms of talking about a youth. It includes, I often think of it as like the big three. So it always, we want to include someone from mental health, someone from education, and someone from child welfare or DCF, if that's applicable to a situation. The Act 264 entitles families to the process, and the process is the collaborative process of creating the coordinated service plan. And so families are entitled to that process. They're entitled to that collaboration. To bring teams together to talk about common goals and needs and make this coordinated service plan. Families are also entitled to access a parent rep for support. We have Vicki, who is often our parent rep through Vermont Family Network that we're using here in Chittenden County. And that is an excellent resource for parents to help kind of just talk with someone that understands the process from a parent perspective and providing that parent voice in this process. I bring this up because it's a really useful tool to have in Act 264 when we're talking about a youth where a teen might be stuck or not sure direction. It's a required tool or process when we're talking about some of those higher levels of care, like residential level of care. It's also a way for families and teams to access our LIT and SIT teams, so our local interagency team, and our SIT is our state interagency team. And those are some higher consultation teams for really some of our more complicated systems cases where we need some higher level thinking and problem solving. And again, there's a lot more information. I do trainings on Act 264. I love to be invited to do trainings at different agencies and schools. So please reach out to me as well to do that. But there's some other resources to access a lot more information about Act 264. I think now I'm turning it back over to Mariellen to that's kind of the system stuff, but now we're going to talk a little bit about some other pieces.
So there could technically be a transition slide here, but I think that most importantly, Jess and I work very closely together. And the reason for that is that when we're talking about a crisis doesn't get resolved in that one, assessment. Part of having a crisis assessment is also really good follow-up. And so one of the things that we really believe in is following up with the primary care physician. We believe in following up with the primary care doctor. And then we also believe in making the system as easy as possible for parents and guardians to access and kids to access, so that this is a lot of information, but it's really like we want everyone to know that calling first call, calling access and intake, it's two numbers basically. And so by making these phone calls, that's your gateway into the system. That's your gateway into any questions that you would ever need. So it's good to have information, and it's also good to know that we want to make this as easy as possible. So when you talk about, oh my goodness, Jessica's another person out there that I might have to call for this and that, you don't have to worry about that, because first call, we participate in a lot of care coordination meetings together. When we have a lot of concerns, we're really open to say, okay, I'm going to talk with Jessica because I think you need more intensive support, or we're going to say we're going to talk about this in a care coordination meeting to really figure out like the best plan. That one meeting is the Act 264 meeting. We have other meetings at Howard Center, and we're really all working together to serve the community. So we work very closely, and also, so part of this is knowing, like I said at the beginning, like who First Call is and how to really access them, and not only access them, but get your need truly met from First Call. One of the things I will also say about First Call is if you're not finding that you're getting your needs met, there are supervisors also available 24/7. We all have different styles. We all have different experiences. We're essentially a team of, when all said and done, of like 50 people. So it's a huge team. And if one person doesn't get your needs met, another person can. So that's our first thing, is hopefully you have a better sense of how to access First Call. With respect to Jessica's part, it's kind of like you have a general sense of what's out there, but you don't have to worry about the details and the how exactly am I going to do this, because you have us here to help you. And then a whole nother area here is more of what we call a gatekeeper training. And really what we like to do is we like to do education around warning signs and risk factors of suicide, because we really believe that having the basic knowledge and being able to ask basic questions around someone's risk, we can all share that, and it helps us to have conversations and then get the help that everyone needs. And so it's really important. And the gatekeeper training is another training that we do. We often spend an hour talking about this, but I'm going to just looking at the time here, just in a quick 10 minutes, just talk about this. The other thing I want to say about having basic knowledge about suicide is that on our Howard Center website, we have you have access, and if we were in person, I would be letting people look at this, but there's a little booklet that basically is suicide prevention across the lifespan. And it's a resource and information guide. And it can be used for parents, providers, and such. And it's a great resource that gives a lot more information. The warning signs, again, just because someone has, one of these warning signs, it doesn't mean that they're necessarily suicidal. But again, it's just like an awareness of, paying attention to when someone is talking about wanting to die and maybe looking for ways to do so, or feeling hopeless, feeling trapped, or having unbearable pain, acting particularly anxious, agitated, having extreme mood swings, behaving recklessly, withdrawing, isolating, sleeping a lot, perhaps using alcohol or other substances. Those are all warning signs and really an indication that you would want to be reaching out to say, I'm concerned. And again, it can be us, it can be your primary care physician. It can also be, a school guidance counselor. Schools often are a huge resource for us, because if guidance counselors or other school providers, have concerns, they're going to be calling us for an assessment, and we work together on that. And parents and guardians are always involved. Want to go to the next slide? So risk factors, there's a whole bunch of risk factors, and I didn't want to include too much here, but basically risk factors are conditions, stressful events, or situations that may increase the likelihood of suicide attempt or death. And they can be chronic or acute, meaning they can be really long-term, and they can vary in intensity. And then the risk factors, they can be individual risk factors, more risk factors that are connected with one's environment, behavior, or family. And so just to speak a moment on this, individual risk factors may be, mental illness. It could be, poor impulse control, questioning sexual gender identity, isolating, loss of relationships, like loss of a parent or a grandparent, and could be, a traumatic event that happened. Environmental factors can be more like, bullying and such. Behavioral factors could include, substance use, and emotional regulation challenges, and then just family risk factors, such as a family history of suicide, and lack of connection or lack of good mentors and that kind of thing. So I could talk again a whole lot about risk factors, but I'm just giving a quick overview. Next slide. When we look at warning signs and risk factors, we also look at protective factors, because that's really essential. And protective factors really speak to positive resources and conditions that promote resiliency and reduce the potential for suicide. And they're really unique to everyone. So the protective factors are, who are your people in your life that you can turn to and support? What are your reasons for living? And how can we really capitalize and access them in a crisis? I think that as people feel worse and worse, they tend to isolate more and more, and then they lose sight of, they feel maybe a burden or what have you. And so our job is to really say, you know what, let's reach out to your supports. Let's identify more supports. Let's figure out what else we can do to increase your network and increase the resources in your life, so that you can, have the support that you need. So a lot of people feel like, gee, you know, it's really hard to talk about suicide. It's really hard to talk about risk, excuse me. And there's a lot of evidence that shows that by asking questions, it doesn't necessarily increase risk for suicide. And we have a 3-step intervention to responding to a suicide crisis. And what's really interesting about this is that a lot of schools have curriculum that would speak to this, and they teach peers, to this 3-step intervention. So this is something that is being taught, like in schools, it's being taught in the community. And basically it's very simple. It's just when someone is struggling, whether with suicide or just depression, anxiety, being able to show that you care, listen carefully, and just be really genuine and let them know that you're concerned about how they're feeling. Be very direct and caring, not really confrontational, but being clear about asking the question, are you thinking about suicide? And if they are, then just say, you know, I'm interested in getting help. You're not alone. I'm here. I'm going to stay with you and get the help that you need and the support that you need. So it's kind of, I've provided essentially a very simplistic overview because again, we don't have that much time, but I've also listed some resources, and I believe that you'll have access to this PowerPoint. So you'll see here that there's First Call, our community and street outreach programs or other supports in our community that you are able to access. And again, they're people that we work very closely with, and sometimes they're much more readily available than we are. They're kind of a first point of contact, and then if you need a more formal assessment, then they link with us. But community outreach is for our surrounding counties, while the street outreach program, surrounding towns. Street outreach is just for Burlington. I've also listed some other supports, Suicide Prevention Lifeline, and there's poison control if there's any concern about overdose, and then a couple other resources for different specific populations. So I'm really at this point, I think I've talked as fast as I possibly could to just get out this basic information, but we have, as planned, which I'm really excited, 15 minutes left, and I really want this to be an opportunity for anyone to ask more specific questions that are true to what you need out of this training. So we can stop sharing the PowerPoint, which is awesome. It's very hard to talk at a screen and not see people. I do far better in person. I still have not mastered the art of presenting on Zoom and feeling good about it. So I'm glad to see some of your faces again. And I would just at this point, Jessica and I are open to talking about anything you want to talk about related to this topic today. So we'll turn to all of you and open to questions.
Thank you so much for this. I came in a little late. I apologize. Jessica, can you tell us again how you're affiliated or what your affiliated organization?
Yeah, absolutely. So I am the intensive services coordinator for Chittenden County. And so I am a joint hire between Howard Center and NFI, and I'm the liaison with the Department of Mental Health. I often say things like, I belong to everyone and have a lot of supervisors. And so I am someone that's just a resource within our county to help people navigate our system and get direction. I do a lot of clinical consultation. That's the bulk of what I do, and really at any level of care. And specifically, I have to be involved around higher level of care. So some of the things that I talked about in our system, but I am open to anyone can call me. I'm always happy to have my phone number be shared with parents as well.
I'm wondering, hi, I'm Emily. I work for Vapor as a youth employment specialist over in Addison County. I think it's so awesome that Chittenden has so many resources. I know we have CSAC over here as our designated agency. And I'm wondering, I guess my question is there, and you talked about the solar system, which is such a great way of thinking about it. Yeah, like I'm totally visual too. What I'm wondering is there a place that has like kind of a family tree map that shows Vermont? Or I mean, I'm tempted to start one for myself, because just to wrap my head around everything. I'm in grad school right now, and I'm trying to just like learn everything and get a sense of everything while doing grad school. So, but I'm just trying to, I want to be able to be a resource for my people that I'm working with, that I work with. And I want to be able to, know the places where I can refer them, and I'd hate to miss anything. That's what I guess I'm saying.
I would say I wish that there was like a visual map. I think I've been doing this job now for 10, 11 years. And so people talk about this all the time. Like, is there just a diagram somewhere and no, I don't know of one. I have created one for myself. And so when I do a training, that's just like an hour and a half training on the children's system of care for Chittenden County, I do have a visual that I've created. I wish it was a solar system thing. I need to find an intern to do that at some point.
I'll be an intern.
Maybe, yeah. You're making a model. So I've made it for myself. And so that's part of what I encourage people to do if that's how you learn. And I think that's how a lot of people maybe learn and can conceptualize levels and conceptualize who and what. But I don't know of a specific diagram.
Okay. Thanks.
Pam has a question.
Yeah, that was an interesting one, Emily. I'm a parent and have been honestly struggling like you have no idea for the past year and a half. I live in Addison County, so that was actually one of my questions. And honestly, I've just been bounced around from primary care. It took me 10 months to get in at UVM child psychiatry, basically had an assessment, and they were like, well, you need to have a crisis to actually find services. So, I mean, as a parent, like waiting for the crisis in order to be able to access any type of therapy or services is just really, really overwhelming. And, without knowing, I did get some services through Addison County. It wasn't the right thing. But am I not able to call Howard because I'm in Chittenden County? And, it's really confusing, and it's really disheartening. And I would love some guidance, because I'm here as kind of almost a last resort. Even my primary care is like, I don't know.
Right. Sometimes what I say to families is that, or providers, is that, while my role is unique to Chittenden County, there are people at other designated agencies that do similar things. And so when I think about other counties, I might say, how about you call the me of CSAC or the me of HCRS? And that person, while again, not always necessarily a kind of exact role to what I do, they can be someone that knows their system. So I often think about that. The other piece is that being connected to UVM, they do have we have a very close working relationship with UVM, with Howard Center, obviously, but the child psychiatry has an excellent social worker connected to that program. So I would highly encourage you, if you haven't been connected, I'm going to give her a shout out for Eliza Pillard, but she's the social worker connected to that practice, and she is very knowledgeable. And even if she doesn't know, she often knows who to call.
So just give her a call and start there. Okay.
Yeah.
Thanks.
She's been also in her role. I think we're all, I've been in my role for a while too, but Eliza's also been in her role for a very long time, and she is a wonderful resource. And you shouldn't have to have a crisis to access services. And in our and just to also understand too, First Call does see people from out of county if they're in our emergency room, but then the CSAC crisis team would see you if you're at home. So that's just, good information. And I know for us, we have our access and intake service that has some short-term case management attached to that, just to help people get connected. But, again, Eliza is a great resource. And then I think if you're continuing to get stuck, Jessica could be contacted just in terms of who is the equivalent at CSAC and how do we make, a link. The other thing is when people get assessments in our county and they're from other counties, we always link back to that crisis team so that, like it's just good practice, like you should know what's going on in your county. So I'm sorry that you've had that experience, and I'm hoping that these couple things might be helpful. Yeah.
Thank you. Yep.
Who is the you of Addison County?
Thank you.
I'll have to pull up something separate, but I will make sure that you get that information.
Okay, cool. Thank you. And I wanted to just let you all know, if you don't know, I'm part of VABR, which is Voc Rehab. So Voc Rehab, we're now going to be called Higher Ability Vermont. And it's a service to help young folk, adults, kind of navigate the workforce in terms of for people who have disabilities. And that is that includes everything from mental health to physical disabilities. And we work with the high school students up through old age. So that is a resource that's in Addison County for you.
I'd also
That was
like
good to know.
that Vermont Family Network will be rolling out a webinar on hireability. So stay tuned and look on our website, but that will be coming to help promote and let people know what that's all about. Thanks.
Martha, where are you from? What do you work with?
I'm sorry, I should have put that. I'm with Vermont Family Network.
Okay.
Responsible for the transition toolkit and all the core team transition events and pages.
Awesome.
Back to me.
It looks so good. Yeah.
Do we have any other questions for Mariellen or Jessica? Cheryl? I think you're muted.
Yeah, I was double muted because I don't use Zoom very much, so I bet you can hear me now. Cheryl Wilcox of the Department of Mental Health. I'm the Interagency Planning Director, so overseeing Act 264. So I came today because I think this is a really exciting way to get information out. I also will say that I have heard from many communities they want to have a Jessica Coleman in their region. So I think Chittenden is really lucky. And Pam, I was disheartened to hear about needing a crisis to access services. So I think what Jessica and Mariellen provided around supports and reaching out is really good advice. And I'm also going to pop my number in the chat in case you need any additional support from DMH.
Thanks for being here, Cheryl. I haven't seen you in a long time.
Yeah,
And
nice to see you.
And yeah, I think the other thing that I'm very passionate about in my role is just I have done meetings, with families, or parents, guardians. I feel like it's really important for people to get what they need out there, and it's not a perfect system, and I'm not going to pretend that I have a magical wand and I'm going to immediately connect you, with a service or a resource. But between our access and intake service and just the crisis service, I think a huge part of the phone support is for someone to be able to call and try to figure out a resource. And if people are stuck, I'm very passionate about figuring it out and figuring out who the right person is to talk with and stuff. And I think it's really important. We all need help and support. It doesn't matter who you are out there. There's a time in your life where you are going to access help and support. We're all humans. It doesn't matter if you're a provider. It doesn't matter if you're a parent. It doesn't matter. We all need support. And for me, when you have that sense of there's someone in the universe that you can talk with and try to figure things out. To me, I have spent my whole career trying to be available and trying to be an advocate and a resource, a provider, a support for resources and such. And so you have our information. And again, the system is such right now where, somehow there's not an instant resource, but we can all be the resource. And so sometimes it's not I might not have the perfect, therapist for you, but what nugget can I give you to provide, hope and help in some way. And sometimes it's just being able to have someone really just listen to you and think of one little thing. And that's what I could give. And I'm very committed to doing that. That's why, just working with Vicki a lot and over the years, we're all working together. And so I just hope that through this very, very quick overview that you all feel like you have someone to turn to if you need to, and we'll figure it out together.
Yeah, and Pam, I want to echo the same thing too. Vermont Family Network is always here for you if you have a question. And if we don't know, we can try to connect you to the appropriate person as well. So please reach out to us and we can connect you with other community partners as well. And we're almost out of time. So I'm going to thank everybody for today's informative workshop. You'll see the link to the evaluation in the chat. Please take a few minutes to complete this so we can make improvements and fulfill our grant requirements. We have many more interesting workshops coming up, and you can find details about those on our homepage of our website, which is vermontfamilynetwork.org, along with the links to the previously recorded ones. We have tons of information on our website, and getting connected to us is easy. You can follow us on Facebook or join our closed Facebook page if you're a parent. We have 2 closed groups, one for all parents of children with disabilities and special health needs, and one for those with adult children. You can also sign up for our monthly e-newsletter or check out our YouTube channel. We're here to help. Please contact us by phone or email. Thanks everyone for joining us today, and have a great day, especially Mariellen and Jessica for taking the time to do this. Thank you so much.
Thank you so much.